Hi guys, it's Doc Janelle. Welcome back to my channel. The subject at hand is community and public health, and we are now going to talk about topic number 4, the Philippine healthcare delivery system. Of course, paano ba natatanggap ng mga tao yung healthcare nila? It is through the efforts of the private and government hospitals na gino-govern ng ating Department of Health. So for this discussion, we will be talking about the Department of Health, the history, the programs, and the current goal and plans of this department. So DOH started in 1898 when Emilio Aguinaldo created the Department of Public Works, Education, and Hygiene. Nowadays, these departments are separated from each other, no? We have the Department of Public Works and Highways, we have the Department of Education, and we have the Department of Health. But when it started, they were all clumped together in one department. But under the Department of Public Works, Education, and Hygiene was a Board of Health for the city of Manila. So basically, itong Board of Health, yung group or yung department under sa create ni Emilio Aguinaldo that would really focus on health. However, it only governed or it only provided services for the citizens of Manila during that time. Later on, the Board of Health and the entire department that Emilio Aguinaldo set up was abolished. And so in 1901, they again re-established a new Board of Health but now inclusive of the other Philippine islands. With this new Board of Health, they created the provincial and municipal boards. So there was an effort to create satellite offices of the Board of Health in the provinces and in the municipalities. In 1905, the Board of Health for Philippine Islands was again abolished and a new group was formed called the Bureau of Health. Later on in 1915, the Bureau of Health was abolished and it became replaced with the Philippine Health Service. Now, this is very unique because the Philippine Health Service was a semi-military system of public health administration, meaning the people who governed, the people who led and headed the Philippine Health Service were actually not doctors or healthcare professionals. They were military people, no? And under that Philippine Health Service, examination boards were approved, and so they required professional license from doctors and dentists and pharmacists before they could practice their profession. In 1941, the Philippine Health Service was again abolished and they created and established a new department called Department of Public Health and Welfare. So now it became a separate department solely focused on health with Dr. Jose Fabella being its first secretary. And then, after World War II, the Department of Public Welfare and Department of Health again had a split. So, it was created na the Department of Health. So, please do remember that, 1947, establishment of Department of Health. And then, under the Department of Health, nagkaroon pa ulit ng isa pang split between the curative services and the preventive services. So if people need cure, it was handled by the Bureau of Hospitals. If for those naman na public health concerns for prevention of diseases, it was handled by the Bureau of Health. In 1951, a bold move was made by the Department of Health with the development of the RHU or the Rural Health Unit. Ang ganda ng plano ng Rural Health Unit. They were like mini hospitals found in the provinces and municipalities. They delivered several medical services katulad ng childbirth, pwede magpaanak sa Rural Health Unit, emergency services, medical dispensary, meron ng pharmacy sa kanila. They were able to do some simple laboratory tests. They can do minor surgeries already in the rural health units, consultations, vaccinations. So there was now an effort from this new Department of Health to really empower the people in the grassroots. In fact, in 1958, they created 8 regional Department of Health offices. In 1970, nagkaroon ng restructuring in the healthcare delivery system. Na ngayon, may tinatawag na primary, secondary, and tertiary levels of care. And later on, towards the end or in another discussion, we'll be talking about the differences of the primary, secondary, and tertiary levels of care. During the martial law, another change was made when DOH was renamed to Ministry of Health. And Secretary Gatmaitan was assigned by President Marcos as the first Minister of Health. Under the martial law, EO 851 was passed, and this reorganized the Ministry of Health as an integrated healthcare delivery system. They created the Integrated Provincial Health Office. So may rural health unit na tayo, right? Mini hospitals in the provinces and in the municipalities. But there was no government or there was no system to control and manage and somehow oversee yung mga hospitals. So they created the Provincial Health Office which would govern yung mga hospitals naman. But in 1987, the Ministry of Health was renamed back to the Department of Health by President Cory Aquino. And then in 1991, this was a very important law that was passed, RA 7160. Please do remember that. RA 7160, they passed the Local Government Code. And why did I say that this is very important? Because the Local Government Code really pushed for the devolvement of the healthcare sector. So, pag sinabi natin nagkaroon ng devolution or devolvement, all structures, all personnel, all budgetary allocations from the provincial health level, binaba natin yung authority down to each barangay, down to each city and municipality, to each local government unit to facilitate health service delivery. So, nung time na create yung Provincial Health Office ng EO 851, ang nagmamanage, may hawak ng pera, hiring, structures, infrastructures, even building of hospitals, ang nagmamanage doon was the Provincial Health Office. But in 1991, nagbago yun. Sabi nila, let's give the power to the local government units. So, ang nagmamanage na ng budget, pag-hire ng mga doctors and nurses, and even pagpapatayo ng mga healthcare facilities were given to the local government units. So, aside from that, they created programs such as the Doctor to the Barrios and the National Micronutrient Campaign. So, I'm sure familiar kayo dun sa Nutriban, di ba? So, yung Nutriban na yan, it's actually part of that, the National Micronutrient Campaign. In 1999 to 2004, under President Estrada, he released Executive Order 102, which pushed for the reformation, the revamp of the health sector reform agenda. So, ang gustong mangyari ni President Estrada, again, magkaroon ng changes in the way that the healthcare sector was being run. So, in 2005 to 2015, President Arroyo continued on the health sector reform agenda and formed the DOH program called Formula Health for One. So ano ba yung purpose? What is the thrust of the Formula Health for One? They wanted to provide better financing, better regulation, better service delivery, and better governance in terms of healthcare. And then in 2012, they passed the Syntax Reform Law, which allowed for more funds to be given to the healthcare sector. Paano nangyari? By adding more tax to paraphernalia, equipments, and products that would be detrimental to health such as alcohol and cigarettes. So prior to the Syntax, ang halaga ng isang sigarilyo around 2 pesos max. But after the Syntax law, tumaas na po to 5, 10 pesos ang isang piece of cigarette. And even for alcohol, no? Karoon ng doubling of price actually. And then in 2015, they started to create the Universal Healthcare Bill. Ang goal ng Universal Healthcare Bill is to really be a more inclusive healthcare delivery system. And so, when President Duterte started his administration, he pushed for the Philippine Health Agenda of 2016 to 2022, which will be the topic after this one. So in 2019, they finally submitted into law the Universal Healthcare. So momentous rather nitong Universal Healthcare Law because this was really an effort towards primary healthcare. What do we mean by providing primary healthcare to the community? Ang gustong mangyari ng DOH, each family will be assigned a family physician. Ang ganda ng plan, no? Na ma-equalize or somehow ma-normalize yung ratio of citizen to doctor. Alright? That people need not go to far hospitals just to have medical attention. Instead, meron ang naka-assign sa kanila na family physicians. So every Filipino citizen shall also be automatically included in the National Health Insurance Program. Ano ba yung National Health Insurance Program natin? That is PhilHealth. So prior to 2019, sino lang ang mga enrolled sa PhilHealth? Employed sector, di ba? Elderly, people with disability, and the poor. Sila lang, no? But now, regardless of employment status, regardless of age, regardless kung nakakabayad ka sa PhilHealth or not, you will be automatically included or enrolled in PhilHealth. Also, every Filipino shall be granted immediate eligibility and access sa lahat ng serbisyo available in government and public hospitals, whether they be preventive, promotive, curative, rehabilitative, or palliative, no? And all services included, medical, dental, mental, and even emergency health services. So this was really an important and bold move to really boost the healthcare delivery system. So, ang ganda ng plano ng Department of Health, no? And aside from that, what are the roles and functions of this department? So, number one, please do memorize this, leadership in health. So, obviously, they create national policies and regulatory institutions such as FDA, Bureau of Quarantine, etc. that would help them implement yung mga policies that they create. They also provide leadership in the formulation, monitoring, and even in the evaluation of the policies, plans, and programs that they promulgate. And they serve as advocate in the health policies, plans, and programs. Second, enabler and capacity builder. So they innovate new strategies in health, no? And very apparent yan right now in the Department of Health. They are really innovative, creative in ways to promote the different services available in the government. In fact, if you will observe itong vaccination of the 5 to 11-year-old, no, naglagay sila ng mga mascot, cosplayers in the vaccination centers to make it more appealing and safe for children. They also monitor the health policies, plans, and programs, as mentioned earlier, and they ensure the highest achievable standards of quality healthcare, health promotion, and health protection. And lastly, they are the administrator of specific services, meaning they manage selected national and subnational health facilities and hospitals. So, hindi lahat ng government hospitals are directly under the Department of Health. Meron dyaang mga ibinigay na nila or tinurn over nila to the regional offices, to the provincial offices, no? But for those that they handle, talagang they make sure na namamanage ng mabuti. They also administer direct services for other emerging health concerns. And lastly, sila rin yung nagpo-provide ng emergency response after a disaster or an epidemic. So now I would love to show you the organizational chart of the Department of Health. You do not have to memorize this naman, no? Gusto ko lang ipakita how it is organized. So, the Office of the Secretary, of course, of the Department of Health, and then look at the different sub-departments, no? Meron silang department on financial management, making sure na yung budget na ibinibigay ng gobyerno ay properly na dadala natin sa tamang mga avenues. They have high health policy development team who will create the new guidelines and protocols. They also have public health services team, no? Ito yung mga group na nag-aaral ng mga number of cases, incidents, prevalence. They also have health facilities and infrastructure development. So ito naman yung group who makes sure na more hospitals are being built and yung mga health facilities natin are at par with the international standards. We also have the health regulation team, including the Food and Drug Administration, to make sure that before medicines and drugs are sold into the community or into the marketplace, they would undergo proper accreditation first. We also have the procurement and supply chain management team. So, ito yung mga nakikipag-bidding if let's say kailangan ng third-party services. And they also have the field implementation and coordination team. Yan. So of course, the Department of Health is currently headed by Secretary Francisco Duque III. The term of the Department of Health Secretary is actually coterminous with whoever the president is. So once we have a new president, he or she will assign a new Department of Health Secretary, and he or she has the power to terminate the term of the Department of Health Secretary and replace him or her with a new one. So the Department of Health's vision is to make sure that Filipinos are among the healthiest people in Southeast Asia by 2022 and in the entire region of Asia by 2040. So now that it is already 2022, can we say that the vision came true? No? The mission of the Department of Health is to lead the country in the development of a productive, resilient, equitable, and people-centered health system. So going further to the Philippine healthcare delivery system, hospitals or healthcare delivery were divided. Divided according to ownership. So ano ba yung mga ownerships available sa mga healthcare facilities natin? They are either government-owned or privately owned. Meron din tayong division of the healthcare delivery system according to scope of services. May mga facilities that provide general services and there are specialty services as well. And lastly, according to their functional capacity. So, ano ba yung function nila? How do they function as a healthcare facility? General ba yan? Specialty ba yan? Trauma ba yan? Primary, secondary, or tertiary level ba sila? So let's talk about this one by one. When we talk about ownership, first, of course, we have the public sector or the government-owned. So these are usually governed by the Department of Health or the local government unit, no? It's important for you to know at this point that the Department of Health handles all national hospitals and or up until only the regional hospitals. Pag bumaba na sa provincial, municipal, city, hindi na po yan hawak ng Department of Health. Hawak na po yan ng local government unit. For the private sector, of course, we have hospitals such as St. Luke's, we have clinics, we have health insurances such as MaxiCare, medicine manufacturers, vaccine makers, medical equipment suppliers, and researchers. So ano yung na-notice natin dito, no? More services are actually being offered by the privately owned sector. And this is what the DOH needs to work on pa, or what the government has to work on pa. Currently, wala tayong government-owned medicine manufacturer. Kaya remember, no, when Omicron surged and naubos ang biogesic, walang mai-provide na alternative ang government natin kasi wala tayong government-owned medicine manufacturer. Wala tayong government-owned vaccine maker. That's why we continue to buy and buy and buy these vaccines. No? Wala tayong medical equipment supplier. Kaya look at what happened to Pharmally. Nag-outsource sila ng third-party supplier, naging corrupt pa. 'Di ba? And also research. So, going further about this, ang mga government or public-owned na hospitals and facilities are financed through a tax-based budgeting system. Meaning, kinukuha po yan sa buwis ng mga tao through the taxes that we pay for. They are managed by government facilities, whether under national or local governments. And please do remember, the DOH governs government corporate hospitals, specialty hospitals, pag-uusapan natin yan later, and up until only the regional hospitals. Pero pagbaba ng provincial, city, municipal, and alike, hawak na po yan ng local government units. So, the Department of National Defense naman po ang nagmamanage ng mga military hospitals. So, hindi yan under DOH. Ano ba yung mga military hospitals natin? Luna, the Philippine Naval Hospital, no? I think sa Air Force meron din. So, itong mga military hospitals give services, of course, to our soldiers. And the provincial hospitals are governed by the district and the provincial governments handle the district and provincial hospitals. And further, the municipal governments naman yung nag-handle ng mga barangay health centers natin, nung iba pa natin mga barangay health stations. Okay? When we talk about the private sector naman, usually for profit and non-profit healthcare providers yan. So, how are they able to sustain their operations? Through user fees. So when somebody goes to their hospital, they want to get their blood taken, they will be charged an ample amount that would really, really help sustain the operation, the entire operation of the hospital. So usually mahal sa private sectors kasi wala silang natatanggap na help from the government. About 65% of the 1,200 hospitals in the country are actually privately owned. Imagine, 65% privately owned. Kaya ang mga tao talaga, they cannot access quality medical care kasi mas maraming private compared to publicly owned. Okay? According to scope of services naman, we have general hospitals which provide services for all kinds of illnesses, diseases, injuries, or deformities. Walang inaayawan na kaso tong mga to, no? Including examples, Philippine General Hospital, Pasig City General Hospital, Quezon City General Hospital. So lahat ng mga hospital na merong general sa pangalan nila, those are general scope of services. Okay? Next, we have the specialty services, okay? Itong mga to under ng Department of Health. So, they specialize in a particular disease, condition, or organ system. Okay? So, this includes, pag according to illness, the Philippine Orthopedic Center. So, lahat ng mga fractures, amputations, bone diseases, bone illnesses, dyan dinadala sa Philippine Orthopedic. For all mental health cases naman, we bring them to the National Center for Mental Health. And then for all infectious diseases, we bring them to San Lazaro Hospital. In fact, di ba, the first case of COVID in the country was brought to San Lazaro. Pag according to organ system naman, we have the Lung Center of the Philippines, the Philippine Heart Center, and the National Kidney and Transplant Institute. Pag according naman to age group, we have the Philippine Children's Medical Center, National Children's Hospital, and the Dr. Jose Fabella Memorial Hospital, where pregnant women would usually go for childbirth. Lastly, according to functional capacity, ito yung sinasabi ko kanina na primary, secondary, and tertiary, no? So you have to memorize this. What services are available in a primary healthcare facility? What services are available in a secondary one or in a tertiary one? So let's talk about this one by one. When we say primary health facility, they have specialists in only 4 departments. Those are internal medicine, pediatrics, OB-GYN, and surgery. They also have emergency services, so may ER sila, and meron din silang outpatient services. They can provide isolation facilities, but they do not have intensive care units. Okay? They can also provide surgical and maternity facilities, a dental clinic, a secondary clinical laboratory. You will discuss this further, I think, in lab management. They have a blood station, a pharmacy, and a first level x-ray. So please do memorize this, ha? For level 2, they have everything that level 1 has. But on top of that, they have a departmentalized clinical services, meaning may ibang department ang medicine, ibang department ang pediatrics, OB, surgery, and some other specialties available. They have a respiratory unit and an intensive care unit. So, ang intensive care unit and respi unit, saan nakikita? Level 2. They do not only have a maternity facility, but they have a high-risk pregnancy unit, or what we call HARPU. No? High-risk pregnancy unit. For those women with complicated pregnancy, dyan sila nilalagay sa high-risk pregnancy unit. They also have a NICU, or a neonatal intensive care unit. The clinical laboratory has been upgraded to tertiary. X-ray has also been upgraded to second level, but their blood is still at blood station. Lastly, for tertiary care, ito yung mga usually malalaking hospital talaga. Tertiary hospitals katulad ng PGH, that's a tertiary hospital. St. Luke's is a tertiary hospital, no? So, they have everything that level 2 has plus residents. So, pag merong residency program, pag pwede mag-training ang mga doktor doon, usually level 3 po sila. Okay? Not only do they have ICUs and HARPUs, but they also have a rehabilitation unit. No? They also have ambulatory surgical clinic. Pag sinabing ambulatory surgical clinic, mga minor surgeries o operahan doon, tapos makakauwi na yung pasyente immediately after. They can also provide dialysis in a tertiary level facility. Tapos yung clinical laboratory nila, tertiary lab na po with histopathology. And they have also upgraded their blood station to a blood bank. And even their x-ray is at level 3 already. Okay? So, please do remember this. So now, we will talk about primary healthcare. As mentioned kanina na daanan ko siya kanina when we talked about universal healthcare. But what is primary healthcare really about? So according to the WHO, it is a whole of society approach. Meaning, everybody will be part of providing healthcare. Hindi na lang siya responsibility of the doctors, responsibility of DOH, responsibility of the hospitals, but everybody will really be contributing to ensure that the highest possible level of health will be met by everybody. Okay? So, paano ba nangyayari that everybody is involved? We involve them not only in cure, but even for health promotion and disease prevention. So, down in the communities, kahit na hindi ka healthcare professional, you must actually promote health and teach people how to prevent themselves from catching certain diseases. We also involve people in treatment, rehabilitation, and palliative care, meaning meron na silang say. No? Dati doctors lang, kung anong sabihin ng doktor, yun lang ang susundin. But now, pag sinabing primary healthcare, kung anong gusto ng pasyente, we will take that into consideration. It's now patient-centered, no? And it should be as close as feasible to people's everyday environment. Meaning, dapat malapit sa tinitirhan ng mga tao yung primary healthcare facilities, no? Binanggit natin kanina, what are primary healthcare facilities? Anong services ang available? So dapat in each community, whether rural or urban, dapat meron silang primary healthcare facilities doon. And this was actually started, the discussions of providing primary healthcare started in the Alma Ata Declaration of 1978. So ano ba tong Alma Ata? So the Alma Ata Declaration of 1978 was proposed during an international conference on primary healthcare held at Alma Ata, USSR, currently Russia, from September 6 to 12, 1978. They had this was a major milestone in the field of public health, and because they expressed the need for urgent action by all governments, all healthcare workers, and even simple communities na talagang to consider health as a priority. No, they wanted all the people of the world to be healthy, health for all. In fact, doon talaga na-affirm that health should be a fundamental human right rather than a privilege. And so in the Alma Ata Declaration, there are actually 10 declarations, no? Una, they properly defined health. You do not need to memorize this. Second, they were concerned over the inequity between countries, meaning bakit sa US ang ganda ng healthcare system, bakit sa Philippines hindi? And they wanted to equalize that, no? They considered health as a prerequisite for economic progress. They acknowledge the people's right to participate again in the planning and implementation of health services, the state's responsibility in the provision of healthcare to all, the reaffirmation of primary healthcare as actually not only an important strategy but the most important strategy to organize health services, the components of primary healthcare. They wanted to align national policies to build political will, no, to achieve primary health care. And then cooperation between nations and health for all by the year 2000. By the year 2000, medyo nawala yung talks about Alma Ata. Until in 2018, a global conference on primary healthcare was again organized in October 25 to 26 at 2018, held at Astana, Kazakhstan, where they renewed the declaration of Alma Ata. So I think there are a couple of commitments made at the declaration of Astana. Again, you don't have to memorize this. So they made bold political choices for health across all sectors. They wanted to build sustainable primary health care, empower individuals and communities, and align stakeholders para mas maraming pondo, mas maraming national policies aligned to primary healthcare. Furthermore, these are the strategies in building sustainable primary healthcare according to the Declaration of Astana. So first, they want to enhance the capacity and infrastructure for primary care. So gusto nila better looking, mas accessible na mga primary healthcare facilities. Dapat daw ma-prioritize ang disease prevention and promotion rather than reactive, no, or rather than curative services. Dapat daw yung mga primary healthcare facilities natin may comprehensive range of services and care. Dapat pwede magpaanak, pwede ang minor surgeries, may medical dispensary, etc. Dapat daw may increased access ang mga tao to the safe and efficient services ng mga primary healthcare facilities natin, and more importantly, dapat people-centered and gender-sensitive. Number 5, they want to ensure a functional referral system between primary and other levels of care. Meaning, sabi natin, di ba, the goal of primary healthcare is to assign a family physician to each family in the community. Ngayon, ang gustong gawin nito, yung functional referral system, people cannot go directly now to a specialist. Ngayon kasi, pwede silang pumunta to a cardio, to a pulmo, gastro, neuro, whenever they want. But once maging maayos ang primary healthcare, lahat ng taong may sakit should first go to a family physician. And then the family physician or the family doctor will be the one to decide if they need to be brought or referred to a specialist. No? So ang ganda ng plano. Then number 6, to enhance systems that prevent, detect, and respond to infectious diseases and outbreaks. So, last slide. So, after the passage of the Universal Healthcare Law, a lot of our hopes went up. Unfortunately, 2 years or 3 years after the passage of the law, medyo makupad pa yung pagpapatupad ng Universal Healthcare Law. So, later on or in the next topic, we'll be talking about the Philippine Health Agenda. Ano na nga bang update about the Universal Healthcare Law? Alright, that's it. Hopefully you learned something, understood the lesson, and keep studying, keep laban. Shalom.